Well, good morning, everyone. I'm so glad that we could all come together on this day as we celebrate Cancer Survivorship Month. And as you know, this is the fourth of our four-part spring series on cancer survivorship. And we have had some amazing speakers, but I would say we've saved the best for last. And I'm really excited. I think you're going to enjoy our speaker for today, Christine Zinke. And I think you're going to love her message because she comes with so much experience in this area, but also the work that she's doing now. And she has a story of hope and inspiration for all of us and some words of wisdom to share. But I just want to remind all of us for Cancer Survivorship Month, I just saw this information this week that, and I know that physicians that I've worked with have noted this over the last several years, that the incidence of some cancers are increasing in our country. And some of it is because our population is aging and we have more seniors now than we have in the past. Some of it, we don't really know why, or, in order for them to say they know why, they have to have the science to back it up. And I think they don't have the science. I think we probably know why this is happening, or we have a sense of why this is happening, but we can't say with certainty why this is happening, but just that it is happening. The good news is that more people are surviving today than in the past because we have better treatments, and which is really good news. And they're always working on getting better treatments, but it's something that for anybody that's diagnosed with cancer knows better than all of us how difficult it is and how much it impacts on your overall life, for, very challenging things, but also positive things. And that doesn't come overnight, that can come with time. But so with that said, let me introduce Christine. She is and let me just share the screen here because I think it will help if we do that. Just have to figure out how to do this. Okay, here we go. Okay, a little better light. See this? Okay, so this is Christine, and as you can see from her backdrop, this is where she works at the Virginia Thurston Healing Garden. And this is their community room, which I've been in that community room. It is absolutely gorgeous. They've updated it quite a bit, but it is the most peaceful, calming place. I encourage all of you to go see it at some point and participate in some of their programs because they have some amazing programs. And as I mentioned, and I had put on all the workshop series, I hope you have a journal or a paper and pen because Christine's going to share a lot of wisdom and things that I think you're going to find very helpful to take for yourself, for your kids, for your family, from here on in. And come with an open mind because we all come with different experiences, different thought patterns. And I think if we can keep an open mind, then that can be really beneficial for the information that we are going to absorb today. And then I also encourage you, because we are in the age where we are totally distracted all day long between the texts, the emails, the phone ringing, things that have to happen at work, people calling you, you're responsible for this, that, and everything else. Over the next hour and 15 minutes, if you can try to be fully present, shut your cell phone off, which reminds me, I did not turn my emails off, and I want to get any notices of emails. So let's do that right off the bat. And because that always happens and that gets fairly distracting too. So we're going to try as best we can to be fully present in the next hour. And I'm just going to encourage all of you to take a big deep breath in through the nose, out through the mouth, and let go of anything that no longer serves you. Okay. And with that, I will introduce Christine. So I first met Christine in 2016 after she was newly diagnosed with her lymphoma, and she came to our floor, and as I was admitting her, I asked the standard admission questions, but I noticed that she looked really healthy, and as I was asking her the questions, she seemed that she had really good health habits. But as I had come to do based on the feedback that my patients were giving me, I asked her questions about her environment. Anything in her house that she could think of that might be toxic, anything on her lawn that might be toxic, anything in her workspace that might be toxic, anything in the things that she does either for sports or for play that might be toxic. And she did say that she helped with the landscaping on her yard, and I, encouraged her to stop doing that while she was going through her treatments because it was going to be a very intense chemo regimen. And so, not only did she stop doing that, she also implemented several healing strategies, which she's going to share with you today. And this really brought her to have a lot of personal knowledge about her lymphoma, how, maybe environmental factors, but also health habits that she wanted to make changes with. And I think you're going to be amazed by her story. Along the way, she also became a level 2 shamanic Reiki practitioner. So she approaches treatment from a very holistic perspective, which I think is, I love in our healthcare system today. I find that we're really making major switches in that space, integrating more of the traditional healthcare system with some of the healing practices that empower people to help themselves to heal. So with that, um, we'll start with Christine. And what I would love you to do, Christine, is kind of share your story about what spurred you to do whatever you could to help yourself to heal, and maybe start from where, you with your diagnosis and everything.
Well, first of all, Orly, it's always so awesome to see you.
Yes.
And I'm always so grateful when we talk to each other, when we get together and just see each other. And I appreciate what you said in the beginning was to come here with an open mind, because I think individually people have different ideas about how they want to approach cancer. And I just want to say, this was my way and this is what worked for me. And somebody else it might not work for, but I'm hoping the things that I have to say might help people to look at things just a little bit differently. Just as I feel, having met you and on our admission, our conversations just opened me up to really look at a big picture, not just a very narrow picture, and a way to approach my cancer treatment that was not single-based, getting chemotherapy and possible radiation, which was on the plate for me as well. But to really look at my entire environment, and I went home and did that. So
yeah, she did, and I was just
I did.
I was so happy for you.
So Yeah, so as you said, I always looked at myself as a relatively healthy person. Even though I had had a major medical event prior to my cancer diagnosis as well. But I lived a relatively healthy lifestyle. I I think most people who know me would say, "Oh, Christine eats healthy, Christine exercises, she takes care of herself, she does all those kind of things." And and that is true. Um, my cancer, so my diagnosis is non-Hodgkin's primary mediastinal large B-cell lymphoma. And
That's a mouthful.
it's a mouthful. It is a subtype of B-cell lymphoma that is extremely aggressive, and um, treatment tends to either work or doesn't work, and they know that pretty quickly whether or not it's going to work. Um, so as I said, it's rather aggressive, and my cancer came on very quickly. Um, my symptoms, my symptoms were shortness of breath, tightness in my chest. When I bent down, I felt a fullness. I was having some hoarseness in when I would speak, and all things that you might have some rationale for, but it was very quick, and I I contacted my doctor, who didn't have, as you know, if you're not going for an emergency, it sometimes can take a while to get in to see your doctor. And I was going to be leaving for Europe, and I wound up seeing the PCP because I know I needed to get in before I went to Europe. And the morning that I had my appointment, I woke up and had broken blood vessels all across my chest. And I really didn't know what was happening at that point, but I knew that something was quite wrong with me. So I went for my appointment. She didn't really know what was wrong. And she's like, "I think you have asthma." And I'm like, "I do not have asthma." So it's like, "Okay, we'll do some blood work, blah, blah, blah." I'm like, "Okay, let's do this." But all I know is it's not anxiety, but it almost feels like if you're having anxiety and you can't breathe, that's a lot of what I was feeling too.
Mhm.
And I knew it wasn't anxiety because there was nothing stressful going on in my life. Um, so I left there and waiting for some of my results, knowing that I had this big trip planned. And when I got home, my husband and I had conversation, and we said, "You know what? If we need to, we're canceling the trip. It's fine. It's okay. We can always schedule it for another time." I hear from I hear from the nurse practitioner, and she's like, "No, everything's good to go. Just go ahead and go. And when you get back, we'll see if we could do some further testing on you and see if we can maybe figure out what's going on." Probably should have listened to that voice. We did, we went, and while we were in Europe, I was just feeling awful. And then I was having trouble laying down and breathing, like to sleep, and things were getting worse. I'm on the phone with the United States trying to get appointments and so forth. I was spending a lot of my trip there doing that, saying I need to get in as soon as I get back. Um, Fast forward to my husband stayed on business there, and I flew home by myself. And on the plane ride home, I had fallen asleep, and I woke up and I couldn't move my arm. My arm blew up like a balloon. I was in pain, and I threw 2 blood clots in my neck and in my left arm. And I knew something was really wrong then. Um, Landed, I took a taxi to the emergency room at Mass General, and that's how I met you. And right away, they knew. They did scans on me. I had blood clots. I was admitted inpatient. They started me on blood thinners, and and they found a mass in my chest. Um, and the mass was, I do have smaller hands, but it was about the size of my fist, and it was about like right here in my chest. And it could have been one of two things, but most likely they thought it was lymphoma, which my biopsy showed that it was a lymphoma. And I was in for a few days and they sent me home. Chemotherapy was going to start immediately, but I went home and had to start on a medication, because what happens with the tumors as you start treatment is they get what's called tumor lysis, and they put off a lot of uric acid, and it's extremely painful. So they started me on a medication for gout to help with some of that, which I was on for a few days, and then they admitted me that next week. And when I saw when I saw my oncologist, chemotherapy was absolutely on the table, and as was radiation. And basically, what they had said is, we will make the decision at the end whether or not you're going to get radiation. And fortunately, I did not need radiation at the end. But what my doctor had told me is a few things, because I was in good shape. Somebody maybe who wasn't as in good shape, they would have noticed some of the symptoms a little bit sooner than I did. But because I was in good shape, it hopefully was going to also help me with the treatment. And he had said to me that my tumor was doubling in size probably every day. So I didn't have the cancer very long. And when it came on quickly. And that's exactly what happened for me. It was extremely scary when I went home, in between leaving the hospital and then starting the treatment, which was only a few days. But I was struggling so much with breathing, I could actually, my cancer had wrapped around my carotid artery as well. So it was squeezing off some of the blood supply in my heart. And I could feel my heart, which is a very scary thing. And I did think I was going to die. I wasn't sure that I was going to make it. And starting treatment, you get some kind of hope that, okay, maybe I can make it, because you are not feeling like you're going to survive it, especially when you can't breathe and you're feeling your heart. So it was a really terrifying time for me. And my treatments were extremely intense. I was hospitalized for 5 days for inpatient, to receive my treatments, and I got 6 rounds. And before you start, they also go through, from the treatment you're getting, these are the things that could happen to you that you have to kind of sign off on. Oh, you might get leukemia from your treatment, and oh, this could happen and that could happen. And you most likely will need a blood transfusion. People really don't get through this without getting blood transfusions. You're going to become neutropenic, and meaning that your counts are so low, your immune system is so compromised, you're going to have to be hospitalized, blah, 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 blah. And you're like, oh, what am I getting myself into? But from there, I was like, okay, this is not going to happen to me. I am going to find a way to not let this happen to me. And when I met you, which was immediately as soon as I got in my room and you came in and we started our conversation about what's around me and what's going on, it was like ding, 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 ding. Okay, this is how you're going to find some level of control for yourself. This is how you're going to figure out the best ways to care for yourself as you're going through this, and give yourself the best possible outcome that you can have. So again, I always thank you. And I'm grateful for having met you, and that that you were the very first nurse who cared for me, because I don't know that somebody else would have said those things to me. And I have always talked to my husband about that, how grateful I am for that.
Well, I think that I really appreciate you saying that, but most important part of this is you were the one that did the work. Because I've worked with a lot of people, and not everybody does the work. But those that do, those that I've seen take control and make some radical changes, whether it's in diet or exercise or their environment, those are the ones that tend to survive. So that's why I'm so happy for you, Christine, because you took control of that, and not control in a bad way, control in terms of empowering yourself with what you did have control over. And you went forward with that. And that made the difference in your life, in your survival.
Thank you. And I feel like I'm going to cry, but no, thank you. Yeah.
It's okay. um, so in terms of your, one of the things that we did talk about was environment, but what did you find helpful in terms of a clean, um, more natural environment and lifestyle for yourself that you would say were most helpful to you in your overall recovery and survival and healing?
So I think one of the things I have learned, particularly about the type of cancer I had, is that there is some connection to toxins. And uh, I went home after my first round of treatment, and I was determined to look at every single area of my life that I could, to see how I could clean up. And obviously, having time 5 days in the hospital, you also have time to do some research and some things like that. And I'm learning, like, oh wow, there's like more than 86,000 chemicals in use today. Like, oh my God, that's crazy. Like stuff like that. And when I got home, I said to my husband, okay, we are doing a full assessment of the environment that we live in, knowing that I can't control anything around me, what my neighbors do. But I could kind of take charge of what was inside my house, outside my house, what I put into my body, and that's really exactly what I did. And there was that level of feeling by doing that, that in some way this was going to give me my best possible outcome. This was going to propel me to a place where I could survive this and get to that other side, especially knowing what, having had the first treatment, like knowing what lay ahead of me and how difficult this process was going to be. So yeah, I wanted to control what I could control, and I did. So like one of the first things that I did was I came home and I already ate organic, but not like completely organic. I would get things that I knew I should get organic. I did that, but I really took a look at my foods in my life. And I did wind up meeting with a nutritionist who worked with cancer. So she was very helpful for me with that. How are my foods processed? How are my foods sourced? What are the what kind of pesticides are in my food? What kind of herbicides are in my food? And how can I minimize that? Because we probably, well, I shouldn't say we probably all know, but a lot of us know we can't completely control that because runoffs and different thing like that, but we can minimize some of it. So, I really made changes around my food, I am not a vegetarian. I do eat meats, but I'm very aware of how there's getting it from small farms, grass-fed, no antibiotics, making sure that they're not raised in these big inhumane ways. And again, that's me feeling that way. But and not having a lot of it as well, having it occasionally, um, my and moving more towards a plant-based, which I feel like I have a relatively healthy balance of that right now. Um, I think when I first was diagnosed, and I don't think this is unusual, I became extremely rigid around what I was going to eat, what I was going to put in my body. I didn't want to go anywhere where I didn't know where the food came from. And I think as you move away and, from when you're first in treatment and diagnosis, of course, you engage back in life. And I know I can control what's in my environment, but if I go to somebody's house for dinner, I can eat that and be okay and just know I can come back to my house and keep it the way I want. But that was extremely important for me. And again, just trying to eliminate as much of these nasty chemicals that we know are in our food, like trying to just get the cleanest food I can or grow it myself, whatever I can grow. We then got our water tested. We have a well. We got our water tested and went through the whole gamut of that. And we yearly get our water tested because it shifts. There's runoffs. There's all kinds of things that from year to year, we find out different about the water. And I think that's something people don't think a lot about. And particularly this new forever chemical that we're now hearing about, PFAS. That is in a lot of water sources, fortunately not in our well.
Right.
The next thing I did was I went through my house and I looked at my cleaning products and or other toxins that we might have in our house and cleared it all out. You do not have to have all these chemicals to clean. Vinegar, yeah, using vinegar, using baking powder, using salt, so more natural soaps. A lot of that is all you really need. And mostly that is what is my house, and mostly that is what my house is cleaned with now. Um, and that carried outside of my house as well. So some of the chemicals, I love to garden. I love to be hands-on doing stuff. But we had an invasive weed across the street from my house that I had been spraying to eliminate. And of course, wearing my gloves, wearing boots, never thinking about having a mask on. I don't know why. But started to read about some of those pesticides and herbicides and got rid of everything. My husband loves a green lawn. We that was going to be important to him, but you know, we were using the products that everybody else uses. We switched all that over to organic products and no pesticides, no herbicides.
Have you
And
progressed
do
in your yard, in your garden, using the organic versus the traditional methods?
correct. We moved everything to organic. And then you know, did other things like my husband has it, I can't even think of what it's called, where they take up little plugs and they put seeds in, you know, to get the yard fuller in a natural way. And I said, I'll hand pull any weeds, I'll do whatever I have to do. um and our lawn is beautiful. Our lawn is beautiful now, all on natural products. um and when I do spray, I spray with 30% vinegar that has a little salt in it. And guess what? It kills everything. You know, you spray it in the sun and it's all natural. You know, there's nothing bad about it. And it works, and it really works. So a lot of changes that way. Even I have a dog, we have ticks, mosquitoes, all that stuff. We do not use pesticides. We have that sprayed with natural as well. There's a lot of the oils that help with that. So the essential oils, and they do a mix of that. It doesn't really, it kind of deters them and pushes them outside of your space, but it works. It works, and you don't feel like you're getting all these chemicals. This year's a little different because I had an injury and I'm not able to do my yard work this year, but normally, you know, I'll have marigolds planted, I'll have mint, which I do have mint coming up on its own, but basil, lemongrass, things that deter bugs
No.
and help with some of that. So I try and put some of that around my house as well and do things in a very natural way. And then just getting back to inside my house, I also went through, what am I storing stuff in? And I got rid of all the plastics. I got all glass containers. I use, instead of, if you're gonna put something in a bag to bring somewhere, I have silicone bags, which they say are more stable, and I'm hoping that's the case. Hopefully, I don't know if we're gonna find out something different, but I don't use plastic bags anymore. I'll use things like that, and everything else, if we have leftovers, gets stored in glass. So that was a big thing, going through products that I might put on my skin, even makeups that I put on, using more like jojoba oil, argan oil, but things that are more natural and not having parabens or all of the other things that we know can possibly cause cancer. Like, it's not perfect. I can't say I'm perfect at doing it, but I'm pretty good at the awareness of it and trying to keep it as clean as I can.
Oh,
Um,
this is excellent. I love your suggestions, Christine.
well, you know, for me, it was that way to really take control when everything in my life felt completely out of control. And it also helped with that fear of, you know, oh my gosh, I don't know that I'm going to survive this. And it just kind of gave me more of a level of calm, a sense of calm that, okay, you can do this. There are things that you can do that are going to help you for your best outcome.
Mm, yeah, that's great. Um, and can you give us a short highlight on best things women and men can do to prevent lymphoma beyond what you've just shared? Because you just shared, like, I love your ideas and all the ways in which you made changes in your life, especially in terms of your food and your environment. But are there other strategies that you found are helpful for lymphoma?
So, yeah, so first of all, like lymphoma, there's like over 70 types and subtypes of lymphomas. There are a ton of lymphomas, and you could probably say more. You worked for years with cancer. Um, you know, I don't know if there's different ways to approach, and and I'm just gonna say, obviously, as I'm already saying, just approaching cancer in general, I would say, not just lymphoma, with these healthy lifestyles and maintaining your weight and not smoking and exercising and avoiding unnecessary chemicals. Uh, and by the way, along with that, there are some groups that I have found, like in educating myself, that really give information on, like, legitimate groups, not, you know, things that are good resources that give you really good information on toxins that you could find out. But the other thing that I did was, I started doing things that help to clear my mind and calm myself down. So prior to having had lymphoma, I had done some energy work. Um, but I started, my very, very closest friend is a Reiki master. And I'm not originally from here, from Massachusetts, but my friend came up and helped out for a while, and she started doing Reiki on me. And I was also very open at the hospital. Before treatment started, they offered complementary therapies. So as soon as I was admitted to the hospital, somebody came in and did acupuncture on me that would help with some of my symptoms. And there is evidence-based research that these things actually help with symptoms. So I would start off my first day at the hospital having had acupuncture, and then a massage therapist also came in and did
Patient's
I
dream,
did
right?
everything. I was like, give me everything, please.
Hey, you
So,
got the
you
acupuncture,
know,
massage
oh
therapist.
my
I mean,
God.
bring it
It,
on, right?
Absolutely. So, I was already having some of that stuff. And my friend came with the Reiki. And then you also, as I was open to all of this type of stuff, you also suggested Qigong to me. So I learned a little bit about that and involved myself with doing some of that as well. And I just think that those things as well as some mindfulness, some
Yep.
meditation. Listen to me. Things do shift as you engage back in life, right? I would definitely do some breathing exercises as well. That was also helpful for me with as I was having the breathing difficulties, just to kind of calm myself down and talk to myself, it's gonna be okay. You're gonna survive this. Let's take some deep breaths. Let's just kind of center ourselves and calm ourselves. So those things I think were also quite helpful for me, along with cleaning my environment the best I could, was really accessing like complementary therapies, I guess you would call them, and things that help to calm my mind and my body.
So, you're describing so well the feelings that you had when you were first diagnosed, which I find is so common with most people that are diagnosed with cancer, lymphoma, multiple myeloma, leukemia. In the beginning, almost every patient I've had has said it's totally overwhelming
Yeah.
and you're scared to death.
Yes.
How long, and you went home and you're like processing all of this and trying to have, keep yourself as calm as possible and doing your deep breathing and exploring all of these different practices, which is amazing, that you were trying to incorporate some of those healing practices. But how long would you say it took you before you started to feel more at peace with this? That not only were you like calming yourself down, but you could wake up every day and the first thing on your mind wasn't, oh my God, I have lymphoma. Am I going to be okay? You know, that you would wake up,
Yeah.
maybe you'd be thinking about something else, like really happy or fun. How long did that take you, Christine?
Question, because I think there's maybe more than one answer for that, because by the time by the time I left after my first admission, um the and I attributed it to the one treatment I had that was a more of a targeted therapy. Um and I left there and was able to breathe a little bit better, believe it or not. Just in like 5, 6 days I was breathing, and there was already a sense of relief, like, okay, maybe I'm not going to die from this. Maybe, this is working, and I can get through that. That being said, um, you're still terrified, you're still feeling awful, and then particularly after that treatment,
Yeah, because it was
really
a
with how
very
it
aggressive regimen, very aggressive.
very, very aggressive regimen that wipes out your whole blood system and everything. Um, Still feeling like I might die, but for just, oh, am I going to survive this treatment too? Was the thought I had. So I think it was hard to wake up during treatment not feeling it, because of the deterioration in my body as I'm going through this, as I'm just trying to literally survive the treatment, which by the way, I did not require a hospitalization, which
Amazing.
is pretty amazing for the type of treatment I had. I almost, but I didn't. And I did not require a blood transfusion, and that is highly unusual for the
Yeah,
the, the
very
treatment that I
unusual.
had. very, very unusual. And you round with the same people because we're kind of all at the same time there. And all of the people that I met, I had 6 treatments. By the 3rd treatment, they were having blood transfusions.
Yep.
And I really attribute it to some of the changes I made with nutrition, some of those type of changes. My very last treatment, it was hit or miss. They felt I needed one, but they were monitoring me extremely closely, and I got through it and did not need it. And that was super important to me.
Which is that's also amazing because, you know, you were getting the gold standard treatment
Yeah.
type of lymphoma, but as we've just mentioned, it was a very aggressive regimen, and those treatments come every 3 weeks, one on top of
Yes.
the other.
Yeah.
And a lot of people will have to delay a treatment because their counts are too low, get a blood
Yes.
transfusion, they get an infection, they're hospitalized. The fact that you got through all 6 treatments without being hospitalized, without getting an infection, without needing a blood transfusion, that is a testament to how much you were doing to keep yourself as healthy as possible.
I really believe that, especially as I said, there were multiple people that I was with, and that was the case for all of them. And yeah, yes. And I lost track of what you asked me. I went off on that little tangent, and now I don't remember what you
Well,
asked
you
me.
know, in terms of your, you know, because you have been so good expressing the feelings that you had when you were first diagnosed, being told, which is so common, totally
Yeah.
overwhelmed, like just being scared to death that you might die. But how long did it really take you before you felt more at peace with, you know, I don't have to worry every day that I might die. I don't have to be so overwhelmed by the fact that I have cancer. Or you would wake up in the morning and the first thing on your mind wasn't, oh my God, I have cancer. You know, what else do I have to do today? Or, you know, you could focus in on maybe a lunch you were going to or a birthday party, or you know, you would wake up and the first thing on your mind was something other than
Yeah.
over.
So I think in feeling like I wasn't gonna die, I think by the middle of treatment, I thought I was gonna survive. I felt relatively confident I was gonna survive. Um, and then it was just a matter of, okay, how can I best get through this treatment is more of what it became. And I think post-treatment, um, as as things as I started to feel somewhat better, cancer wasn't the first thing on my mind. And that does take some time. Um, but it was a while afterwards. It really was a while afterwards because you get through and then you worry about recurrence. And certainly the type of lymphoma that I had recurrence is not a good thing, because it usually means a stem cell and so forth is next and so forth. Um, so it was quite some time, but I did get myself involved with the Healing Garden,
Nice.
and right off the bat I did. And started to attend support groups, because the other thing is going through cancer is it's a very isolating and lonely experience.
Mhm.
And
I'm
it
glad
is not that, what's that?
I said I'm glad that you mentioned that because that can be very true. You know, people go home and they're the only ones with cancer and they're the only ones that know how they're feeling. So I'm glad
Right.
that.
And it's not that I had a lot of support. I had a ton of support and people who were showing up and helping to take care. And again, while my husband was at work, I had people staying a week at my house helping out. Through every single treatment I had, somebody came to my house and helped out when my husband was during that first week, while he was at work. And I had all of that. So I wasn't lonely. But but people did not quite understand what I was going through, on an emotional level, on a physical level. You could see the deterioration in me, but on an emotional level, I would say something, and even my most supportive friends, who were social workers, by the way, would be like, yeah, and they try and support me. I actually had my closest friend, unfortunately, she had cancer about 2 years ago. And she said to me, and who was wonderful, by the way, I mean, so supportive. She said to me, Christine, I never quite understood the things you were saying until now. And she said, I completely understand everything you were talking about. And that's one of the reasons why I got involved in the Healing Garden, because it was a place that I could go to where people just got it. They understood. I could say whatever and they got it. I didn't have to say much more, because you're in a space, even, post-treatment, where every time you go, you're going for scans I was going like every 3 months, and then it spread out a little bit more. And every time you go, you're like, is this going to be it? What are they going to find? And by the way, they also find other things on you while you have scans too, that now
I
I'm followed
don't
for
want.
that too. It's like, oh my God, now I got to be scanned for this other stuff too. Um, but it's terrifying. So for a long time, you're feeling these things. Um, I would say it was actually a couple years before I woke up and I'm like, okay, I'm gonna be okay.
Yeah.
I'm gonna be okay. I got this. I'm gonna be okay. It was a time thing. It was the further I got away,
Mhm.
and the more I had clean scans, the more things, my blood work improved, the more I felt better.
Mm.
Um, I I started to kind of put it back there, and I would wake up having different thoughts, and I woke up more wanting to engage back in my life again. But it definitely took some time, and some of the side effects for me lingered for, like, even 2 years out. I was having
Mm.
some significant side effects from the treatment I had.
Yep.
Yeah.
I'm so glad you mentioned that, because I think for a lot of people going through cancer treatments, there's this feeling like, well, I've got to get better right away. Is this something bad that's happening to me? And um, it's so helpful that you shared it took a couple of years,
Yeah.
that people can be patient with themselves and say, this is okay. You know, I this isn't a bad thing. This is just part of my healing. And
Yeah,
that's part of overcoming this very traumatic experience, you know?
absolutely. And it's really hard to do that. At least for myself, listen, I just wanted to get back into my life. I just wanted to be kind of put that back there, and okay, I survived this, and let me just do the stuff that I do. And I was engaging back in life, but it was not, I wanted it this fast pace, and it was just not happening that way.
Yep.
And I really had to develop like a healthy respect for what my body needed
Yep.
and try and be kind to myself,
Mm,
um, to give myself that.
yeah. Yeah. I think that's a good way of putting it, is being kind to yourself, being
Yeah.
compassionate with yourself.
Yeah.
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 I know that you do the Reiki practice. Can you talk to us a little bit more about that? Because I know
So,
some people that know about it, but there may be people here that have not heard of Reiki or have not, they don't really know. They've heard of it, but they don't really
yeah.
know.
So Reiki is about life's universal energy, right? We're surrounded by energy from Mother Earth, from the whole universe, from all of that, and all of us have the ability to access energy. And I think just like even if you rub your hands together and you start to go like that, most people can feel that energy work start to happen. And it is about taking that taking that energy um and helping to transfer, working like a conduit or a hollow reed, and um you either place your hands on somebody's body or you hover over, depending on people's comfort level, but it's helping. So for many of us, particularly after we've had a physical trauma, an injury, an illness, we get blockages in our body. And with Reiki, it's taking that energy and helping to move that and helping to clear that energy. As I said, I had done some energy work prior to, not Reiki per se, but energy work, prior to having cancer. I'm sensitive to feeling it. Um, when I was having Reiki here in my house from my friend, this is a funny story. Um, my dog would be laying in her bed next to me, and my friend would be working on me, and I I get a sensation, I get chills, and then a release when I feel blockages go. Again, some people feel nothing, but I do feel, I feel it and can tell when stuff is moving in me. Um, my dog, at the same time as I would release, my dog would go and release at the same time. And
Oh, that's so cute.
after the first time that happened, my friend goes, yeah, animals are sensitive to energy. And of course they are, because they know something's happening before we do, right? There's going to be an earthquake. There's going to be a storm coming in. They know all that. But that would happen. But um, so the Reiki, it helps with blockages. It helps with, for me, it brought a sense of calm and
Mhm.
it brought a sense of being grounded, which was really important while I was going through my treatment, was helping to calm myself, but also um, the medications I was on, I couldn't sleep. There were that was really difficult. And the days that I would have Reiki, I I would sleep. I would sleep, not for hours and hours and hours, but it would help me to fall asleep. It would help me to be grounded so that I could feel balanced and just come together in a calm way. Um, so that energy, even whether you believe in it or not, it's happening.
Yeah.
It happens, and it really it moves the blockages, and it goes to where it belongs, and it really helps to people to just balance out and be grounded.
Mm, yeah. Let me just bring us to this page right here with it's the shamanic Reiki is the style that you do, because I'm guessing there's several different types of Reiki.
Yeah, so the shamanic Reiki kind of it taps into a little bit more shamanic practice from the shaman, which go back, thousands of years. Shaman use connected with earth and the gifts of the earth. And um so it has a little bit of a different feel. I might bring in um where when I'm doing Reiki, if I sense that energy has to go somewhere or that there's a blockage somewhere, maybe I might put a rock there to take some of that blockage, let the energy go into the block, and then I give it back at the end to the earth to recycle it. And because that's what we do, it recycles and it goes back, and it comes back in a new form. So I might use something like that, or I might use a feather to help, like, clear the energy, clear it out of your body as I'm moving along. So somebody who doesn't do shamanic Reiki is not going to be using those kind of things. So it's using practices of the shaman um, that have been used for thousands and thousands of years.
Mm. Oh, that's beautiful. I love that. Yeah, as you mentioned, I myself do qigong, and the gentleman who founded Spring Force Qigong talks all the time about, the energy that flows through our system. There's energy all around us in the universe, but there's certain blockages, and that's where you see some of the ill health. But by doing the practice of the qigong, it helps to open up the energy. And he says, if you believe it, it works. You don't believe it, it's
It
still.
works. Exactly. That's what they
Yeah.
say, right? You don't have to
Yes.
believe it. It just works. And it's so I have a rescue dog now, not the same one, not the same one that I had when I was going through cancer, but I have another rescue, and she has a lot of anxieties, a lot of fears. We don't know her history, but it was not good when we got her. But she is it could be a beautiful day like today, and all of a sudden she'll start shaking. You're like, oh, okay, the weather might be shifting. What's going on? She's my person that I do Reiki on. But she's very afraid of thunder, lightning, and she feels the storms coming way ahead of time. So her whole body will shake. I do Reiki on her, and it's really interesting to see how when I do that, she'll be shaking, and then she'll kind of
Calm down.
relax and calm down. And then you might get a little shiver again. But it calms her down. It's
It's
crazy. It's just, there isn't like, hey, I believe it, I don't believe it. It just works on her.
great.
Yeah.
I know that we had talked about some of the resources that you have found to be so helpful. So, can you talk a little bit about the Women's Voices for the Earth? And I think there's another one on the next, yeah, another on the next.
So So the Women's Voices for the Earth, so just looking at different things. I just found that because they um advocate for getting rid of toxins in our environment. And I just liked that. I don't like that getting emails and, hey, can you sign da 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 da. But I like that they gave a lot of information about what toxins are around us and what toxins to be aware of in your environment, and what things you can clean up. So they have a lot of information about that. And then use the other one with the PFAS. They're, as I said, I'm very aware of the water. I'm also aware Massachusetts, and I'm assuming because we we're one of these founding states that had a lot of industrial stuff and unfortunately dumping and all of that. There's a lot of contamination in the water with PFAS, and we know most of us have PFAS in us, but there are some resources to find out a little bit more information about that and where are hot spots, and now there's more information coming out about even how filtration systems to try and clean some of that out. We actually, as I said, I have a well, but part of my town is not on a well system. They're on public water, and they found that there was some contamination in it with the PFAS, and they're going through a big cleanup process to give us clean water,
Wow.
or give the part of my town that doesn't have the wells clean water.
Yeah.
Just so important. And there are, if you really look it up and just look for reputable sources, there are other sources out there that will give you information, just specifically in Massachusetts, for what are some of the chemicals that to be aware of.
Yes,
Yeah.
this is the link right here for anybody in Massachusetts. The www.mass.gov/info details per the PFAS.
And
So,
I also, I want to give a plug just for, I'm sorry, I don't remember his name, the gentleman that you interviewed about the lawns.
oh yeah,
Uh,
Chip Osborne, he's fabulous.
I mean, awesome, because that was one of the things that we also did. And again, I can't control what my neighbors are doing, but yeah, we went organic. Our lawn looks fantastic. And I don't think we realize just what we're putting around us all the time.
Right.
So,
Yeah, and what I really liked about what Chip had to say that you kind of highlighted is that your lawn doesn't have to look worse because you're not putting all those standard products on it. You can have a natural organic lawn
yes.
and it can look absolutely beautiful. Now, in the beginning, did you find there was a little transition period from
Um,
before it looked absolutely
that
beautiful?
hard for me to say, because we did it immediately, and I was going through so much else. I don't think I was really paying attention to my lawn. So that's a hard thing. I think there were areas where my husband wasn't satisfied, but again, I can't think of what it's called when they take the plugs out and they put the seeds in to help thicken the lawn. Yes, that took a little time in some areas to get it a little thicker. But like that was not a priority on my list, was paying attention to how that looked.
But
Gee, I wonder why.
the final product was,
The final product is our lawn looks fantastic today.
oh, good to hear. Yeah. And here's a couple of more recommendations that might be helpful to people is this book, Children and Environmental Toxins. This is something that I have been aware of before. Philip Landrigan is a physician and his wife is in public health. He's also in public health. He's done programs for the Harvard School of Public Health, but he's mainly out of Mount Sinai. For anybody that has children, I would highly recommend reading this. Or if you're thinking about getting pregnant, I would highly recommend reading this book before you get pregnant. It is packed with really helpful information. And I'll put in a little plug for myself, but Short, Sweet, and Sacred is a gem of a book. There's 59 of us who wrote very short, like 3-page true stories of courage, inspiration, hope, and Christine is highlighted in my chapter, but that is a really, there's some wonderful stories in there of hope and inspiration on many different levels. And it's something that you could start in the middle of the book, just read one chapter, 3 pages before you go to sleep at night. And the next day you're reading the last chapter of the book. They don't go in order. There's just random true stories. And then Christine, maybe you could talk about Dr. Wu.
So, just, in my day, I'm active, I'm busy. Um, right, right now I have an injury, and by the way, the gift that keeps giving with the collateral damage of chemo, I got osteopenia, osteoporosis now from, unfortunately, these are the things that happen. And I broke my ankle, so I'm not doing much physical activity, but I need something. I'm a walker, and I'm active in a whole bunch of other things. So in terms of doing something quick, Dr. Wu just has a quick little practice that takes 10 minutes to kind of center yourself and get that balance and keep you focused and mindful. Very, slow moving, but again, centering. And then that Thai flow, it's a woman and I just like her stuff. And again, it's like 5-10 minutes of just doing a quick little video that they walk you through, and you just get a sense of calm and you feel present after you do it. So it's just very nice.
Yeah, I'm glad you shared these with me so I could put them on here. Because even though they're only 5 or 10 minutes, you do notice a difference, right?
Yeah,
Yeah,
you don't, it's wonderful if you have the time to do it, and it's wonderful if you make the time, but as you get more in, as you're recovering, you get more involved in life. Um, you get more involved in life, and you do have to make time and effort to do these practices. And I do find if you can have something short, it's easier to have those things and follow through with those things.
right. Good point.
Yeah.
So with that said, I am just so thrilled that you could be with us today, Christine, and share your beautiful story. I get something out of it every time I hear what you have to say because, as you know better than many, this one baby beautiful day, not everybody gets to wake up in the morning. And those of us that are here are so fortunate to be able to experience it, to live it. Um, and so for those that do have cancer, there is hope. And I think Christine has a lot of wisdom in her message of how you can empower yourself and you could ask your doctor, ask to have a consult with a nutritionist, or maybe it's a physical therapist that might be helpful, or finding those support groups in your community so that there's other people that can relate to your story. You don't feel so alone, right?
Absolutely.
And get the
Absolutely.
support that you need.
A-
So,
And just to give my little plug,
sure.
the healing garden was that for me. It was that for me. And when I got to a place where I was feeling better, I wanted to give back, and I felt like I had a lot to offer.
Yeah.
And it is it is I think it's getting more known now, but it was a little gem that wasn't known much about, and it is an amazing place to go for support. Whether it is educational groups, whether it is just wanting to feel like you don't have cancer, and wanting to connect with people, or wanting to get those complementary therapies that are so helpful in having you to have your best experience as you go through treatment. um you can pick what you do. You don't have to do everything. But the one thing I can tell you is you can go there and not feel defined by your cancer, but held and supported in the way that you need to be.
Mm. And I would ditto everything that Christine is saying. For anybody that has not been to the Healing Garden in Harvard, Mass, I highly recommend that you go there, you visit it. Do they still have the paths around the property where you can walk through the gardens?
Actually under a little bit of construction because we are a nonprofit, so we're grant and donation funded, and we just recently got a grant to do some improvement with the garden work. So we're putting in a labyrinth,
Oh, wow.
putting in a patio, and it's a different area where our pond was. So of course I haven't been there because I with my injury, but I hear all this is going on. And also doing some additional garden work. But yes, and we do ask if you want to go there to please call, let us know. We can give you a tour. We don't just want people showing up at any time. You can come, but just let us know, and we'll work with you around arranging a time and educating you about the place, because there's a lot of nice history about how it started, and that's wonderful to know as well.
Yeah,
So
very much of a healing space. There is a
yeah, meditation garden there's like everything there. It's really wonderful.
Yeah, and Christine is such a beautiful addition. I mean, you've been there for what, 5 years now?
I started in 2016 with my diagnosis. As soon as I was diagnosed, I called them. And then in 2018, I was hired as a staff person.
Yeah,
I'm not full-time. I only work 2 days a week, but I'm there. Yeah.
very
So I've
integral.
been there a while.
Yes, you have, and you're a gem. So, well, we appreciate all of your wisdom today, Christine, and know that you are a gift to anybody that has cancer, to give them that hope and inspiration that you found in your empowerment. And I send you lots of positive energy. Beautiful rest of the day.
Thank you. And always my love to you and my thanks to you.
Yeah. Okay. Yes. All right. Thank you so much. And for anybody that's interested in stepping forward with more of these programs, I am going to be starting a new program for people that have preschoolers, so that if we can help them get out on a good start in life, so that they never have to experience cancer, or if they it's much later in their life, then I hope you'll join me. I will put that up on my website, www.bewellnessparenting.com. So I hope that I see you soon. Okay. All right. Bye. Thank you so
Bye.
much, Christine.
Thank you. Have a wonderful day.
You too.
Bye.
Bye. All right.
Nope, you're still recording.